Hello, it's Dr. Durst, and today I wanted to do a video testimonial with one of my nurses. And again, Megan hasn't been with us long, but I love to do videos that actually showcase lots of different scenarios. You know, somebody that might have been with me for a long time, or as you've seen other ones, videos of patients that have been with us for a long time, or somebody that was even with us for a short period of time with improvements, just so we can share all the different stories. And so I wanted Megan to talk about her journey. And so do you want to tell us a little bit about yourself and how we ended up in front of each other?
Sure, absolutely. My name is Megan. I am a sexual wellness and hormone replacement therapy nurse here at RevitalyzeMD. And this is my absolute dream job. So I found Revitalize when I was researching hormone symptoms and looking for help in 2023, and decided that this is what I wanted to do, to be able to help other people that were going through hormonal changes and suffering. And I had already had my own difficulties in trying to get help from a primary care physician, trying to get help from my gynecologist, and just meeting a lot of dead ends. Mm-hmm. But I knew that something was wrong because I no longer felt like myself. My husband knew that, you know, I was going through the change, or whatever people like to call it, but the symptoms, you know, just kept multiplying. So I think my passion for wanting to help other people going through this really grew over time. And I've been a nurse for 12 years. I've had a lot of really good nursing jobs, and just still this always stayed in my mind as something that I feel very passionately about, and that I just felt like it was my calling.
I love all that. And so it's been a very short period of time, and it's been fabulous. Like, it's been a great fit both ways.
Thank you.
And I haven't even really evaluated her for her hormones myself. And so Faraday and Megan have looked at that. And I think that even me asking questions for the first time, because I really don't know if you were on hormones when you came to us.
Right. So I did find a GYN, a nurse practitioner, that tested my hormones. And that was at the end of 2023, and my testosterone was 5. And so she gave me some orally dissolving tablet that I took for about a year, and they helped a lot at first. You know, they pulled me out of the 7th circle of hell, I like to say.
Or the 7 dwarfs of menopause.
Yeah.
Or perimenopause.
Like, I didn't want to claw somebody's face off anymore. But so it was an improvement. And then over time, it still wasn't working, I guess. And so the night sweats, the insomnia, the 3 a.m. wake ups, the irritability, everything was just like, again, not myself. And so I had a primary care physician who was willing to continue refilling that testosterone tablet, but he definitely did not feel comfortable changing it at all. I knew there was other options besides just that one, you know, mode of
replacement.
Yeah.
Were they doing progesterone at all at the same time?
Okay.
No. And so again, I think that not feeling like yourself, and now that you've been here, it's not as if, so when you're in the medical field, Megan is an extremely experienced nurse. And again, we hear all the complaints of not only just patients, but women too. And I think that not feeling like yourself, but hearing everything is normal is pretty common. So you've mentioned that a couple times now. And I think that's probably the biggest thing.
Yeah.
And so again, she's early in her journey for the hormones, but I always like to hear what all those symptoms were beforehand. And it sounds like the perimenopause symptoms have hot flashes and night sweats and not sleeping, and the mood. And you're just
the libido zero.
And
you know,
zero.
I have this wonderfully gorgeous husband who treats me like a queen, and I had no sex drive. And it's like, he's hot. Why do I have no sex drive?
Yes.
You know, I mean, that is like, what is happening to me? Like, you kind of start to feel like a shell of your former self almost. The irritability where you just like feel like you could spontaneously combust just walking down the street if somebody looked at you the wrong way. I mean, it's just really, it's bizarre.
It's like a short fuse.
Mm-hmm.
And even just the emotional, like sometimes being tearful or getting upset over things that that didn't. So, and again, I think early on we had decided, which we do with, you know, our staff when they come on, because we want them to feel their best. And if they're experiencing symptoms, we don't wait. And so we early on looked at your hormones. Right. And so tell a little bit about the experience, like what happens now that you've seen also what patients go through, you know, how they come in, how they should feel when they come in, what they should expect, you know, all of those things. And then how you feel after going over your labs, you know, the first time in a very, and how that felt different or didn't feel different from like the first time you did it with your gynecologist.
Yeah. So that, the first time that I went over my labs, it was just a progesterone, a testosterone, and an estrogen, those three things. That's it. I was grateful for the help at the time, of course, because I was miserable. But comparing that experience to sitting down with a provider here and having a full panel of all my labs to look at was really, it was just like some justification, I guess, that made me feel like, oh, I'm not crazy. Okay, look at this. Things really are not where they need to be feeling good or to even be functioning. And I was feeling that. So it kind of was just, it was almost immediately comforting to be sitting there at a desk with somebody that could explain, this is why you feel terrible, I guess, and not having somebody just trying to give me an antidepressant or something like that, you know, when that's not the problem. And so I had a choice if I wanted to do, I had no testosterone at all, hardly. And so I had an option if I wanted to do the injections or pellets, and I just opted to do pellets because I don't know why. It just seemed so much more convenient, fewer needle sticks, and the entire process and procedure was virtually painless. It took maybe 5 minutes. I was shocked that I didn't feel anything except the initial lidocaine burn, like that is inevitable. You're going to feel that when there's lidocaine. And I was shocked when she was done. Like, and so it's funny because now that I'm the one doing that procedure with people, they're like, "You're done?" And you're like, "Yeah, we're done. Bye. Have a great day." And so.
And how do you feel after the pellets? Did you notice a difference?
Oh yeah. I mean, I feel amazing. Like I feel like my old self again. I think it's been about a month or maybe 5 weeks, but I feel happy. I don't feel like I have to get in front of my seasonal affective disorder light that I would use. You know, we all like have that in the wintertime, but last year it didn't end in March like it normally would, the like seasonal whatever blues that people experience. And I was using that light up until June and July every morning. And I was like, why do I have to still use this light? I'm trying to get myself to feel good. And so I feel like my normal kind of high energy, happy, positive self that I've been my whole life.
Awesome.
And my libido's back. Thank God.
And so how has your husband noticed a difference?
Oh yeah. He's thrilled. He's like, I can't wait to meet Dr. Durst and shake her hand.
I laughed over periods of time. I've even had nurses that I've worked with in the ER over years, and like their husbands, you know, I haven't met, or vice versa. And so I'll see them and it'll be like, when are you going to see my best friend? And so I hear that so frequently, but then occasionally at Christmas time, I'll give them a hard time. Like I haven't gotten any presents from my best friend. So you're here to see me. And they actually did bring, you know, it was like chocolate covered, like
that's nice.
Fruit or something they sent to the office once. So it's fun because again, it does improve relationships. And so did you end up needing progesterone?
Yes, absolutely. That was sort of what started the conversation with on my first day of employment, because I had been up since 2 a.m. and I was trying to function all day in this like computer training. And I was not able to focus, and I was really struggling. So we got some progesterone capsules on board. And the first night that I took it, I slept for 9 hours straight. I didn't even get up to go to the bathroom. I mean, the only thing I can equate it to is if anyone that's ever had children, the first time you sleep through the night with a baby in the house, like, because you don't sleep for like so long. And then finally when you do, it's just this weird, almost like disorienting feeling
in the morning
that you can't believe, oh my gosh, I slept through the night. And it was incredible.
The only difference is that usually when you sleep through the night for the first time with the child, you wake up almost nervous, like, oh my God, what happened to him?
Yes, that panic.
Can you believe it? Yeah, you're panicked. Like, what happened? Oh my God. Are they still alive and good?
Right. Yeah, there's that.
Yeah, that's the only difference, I would say. But,
the many joys of motherhood.
Yeah, exactly. Well, it's always guilt and shame from that point on, right? And so it's just part of motherhood.
Yeah.
But do you feel like because you have conversations every day now with women, and we do a lot of women in hormones, and we're very passionate about that. And, again, we love women to have, all the information, but we want them to have the choices too. And it's their journey. It's not ours. And so we're just here to help. But how do you feel now that you talk to women? What do you hear most commonly with women that are coming in? And like, what would you say that you hear on a daily basis or most frequently?
Number one, vaginal dryness. And that was actually probably one of my first symptoms. I think I forgot to say that, but where you're just like, it's just so uncomfortable, and then pain with sex, and somebody will throw some estradiol cream at you. Maybe your GYN will do you that favor, but that doesn't really fix it. Like, that didn't work for me. That did nothing for me, honestly. And the irritability factor, they can tell that they're being like difficult to get along with their family members and friends. The low libido, no libido.
Those are the common
I would
ones.
say those are probably the most common.
And so then you were looked at with the labs and determined to be menopausal, needing estrogen. Yeah. And then because
not estrogen. I'm not there yet.
Okay.
Just the progesterone and testosterone.
Yeah. You bring up a good point, because when it comes to any kind of vaginal dryness, hot flashes, or night sweats, a lot of physicians will actually just assume that is an estrogen need and put people on estrogen. I don't know if you've seen that with our patients yet.
Yeah.
But it sounds like that's what you were kind of saying, that estrogen cream and throwing that at it doesn't always help. And it didn't with you. And it's really not what's needed in progesterone and testosterone. So yeah. And do you feel like I hear a ton, I just don't feel like myself. Yeah. Like, that's a really common complaint. And so while we do a lot of sexual wellness, and I want to say that one of the things that we love is for people to have better sex, really, I think that that's just one part of, they really just want to feel like themselves again. Yeah. I think that's the overall goal.
Yes. And I think at the height of it, I would say I felt possessed. Like, I couldn't stand to be around my own self.
Okay.
I was like that, disgruntled or whatever. Yeah. So.
Well, and again, it has been a perfect fit. Megan is amazing and she's great with patients. She understands. And I think that, I can say that too. Like, I get what women are going through, which what makes it easier. And then I love the fact that when we talk with patients, we're like, listen, you're going to have questions and you need to reach out to us, because I think we're balancing hormones, you're going to have questions about that. There's going to be things you feel. And so you need to feel comfortable reaching out to people and getting answers. And do you feel like that is, like a big value of going to the right place? Because it might not always be us, but
I just wish it's something I would have done a long time ago, I guess, because I think of all those years that I was suffering, even on a lower level, and just uncomfortable, or it was just annoying symptoms. It wasn't life altering, but I didn't even have to be going through that at the time, and so I think that if people are experiencing any of those symptoms, that's the time to reach out. I had a patient recently who was kind of younger woman, but she just had a baby and her hormones are all messed up from that. And so it's just like that. Yes, you don't have to suffer through months or years waiting for your body to get to correct itself or whatever.
I agree. And so I think if we were to recap some of the things that we'll talk about on a daily basis, just to kind of put it in perspective. And then Megan was a perfect example of how we address it in the office. But there's perimenopause and menopause, and perimenopause is a transition you're going through. And so the first hormones that really drop are progesterone and testosterone. And so when somebody comes to us and they're on estrogen or they've been tried on estrogen, I want to make sure that I see labs that are going to say, yes, this is, even if they're 65. And we had somebody, today, right? That was 65. And it was like, you should assume, but I still like to see the labs confirming that their estrogen is in the range that I would want. And of course, again, it's probably just me being very anal about, but I like to see numbers that support what I'm doing. And in perimenopause, we need that to look at brain hormones and to, ovarian hormones, just to see where we are. Progesterone is mood and sleep. So it's what you were talking about. And they put you on testosterone, but not progesterone. And then testosterone is brain fog, low energy, body composition, and libido is one part of that. And better sleep actually too is something. And then there's a lot of behind the scenes things that it does. Estrogen is once you hit menopause. So the transition phase is over, menopause, and you've transitioned over. And we want to we want women, we want to treat them during perimenopause and start that transition and treatment right away. But we had a patient today, a perfect example of a lot of physicians and providers or offices will not touch an older lady that doesn't feel like herself and wants to feel like herself, but they're not going to end up in front of us if they're not thinking differently. And so this lady is approaching 80 and does have some medical issues, but again, with careful evaluation and also careful treatment, she was right there with us with progressive thought today, right? Where she's like, I feel like women should have a choice of whether they need to feel better. They just need to know the risk factors and make informed decisions about that, right? And she felt great. It completely still had a sex drive. She
79 years old.
And so it was amazing to see that. I don't think a number should tell you that you can't have something and you can't feel like yourself. And people aren't ending up in front of us at that age that are hesitant to do it. So I think we should just allow them options, right?
Yeah,
and
absolutely.
So I think that was a great patient to see today.
Yes.
Because
it was inspiring.
That's what I want to be when I'm 79.
Exactly.
Right? And so, but it's great to hear. So I am so glad that you found us.
Thank you.
And,
ditto.
And it's, again, we're getting ready to expand to a second location. So there's some transition going on. But it's exciting times, and but it's a lot of work. And everyone here is, again, they're great at working together, and they want to do for the exact things that you feel like it's your calling. They're here because they really believe in the solutions we're providing. And you just don't get those solutions, in traditional medicine. And so it's just a different mindset. So I'm glad you found us.
Thank you. Me too.
I look forward to a long journey with you.
Ditto.
So thanks for sharing everything. And again, we just wanted to share, it's early in her journey, but it's going to be a long one together. And I think that's a good example of how quickly you can feel better. And again, we had somebody else ask today, how long do you think it'll take? And maybe a couple weeks until you really feel better. And she was kind of shocked at that answer, but you would say the same thing. It's just a matter of weeks. And I think this is medicine that does actually make a huge difference in quality of life. And so I don't consider it medicine. I just consider us giving the body back what it needs. And it's not medicine, and people don't have a problem with actually committing and staying on if they actually see the difference and feel better. So don't be afraid to reach out to, again, A4M is a good one to look for potential providers. We do a lot remote patients, and sometimes it's worth getting on a phone call, kind of getting an overall picture, and then also making a decision. And sometimes there's local providers if it can't be something that's done remote, but it is something you should look for a solution to.
Absolutely.
And there's lots of solutions out there, and you don't have to live with somebody else telling you need to accept a symptom as you get older. So hopefully this helps, and let us know any questions or comments, and look forward to hearing from you.